Hey guys, it's been 2 months since I had my surgery, and I'm giving you guys an update on how I'm doing with my hair and everything. Reason why I'm wearing the shirts because I'm going to work today. So if you guys are like, "Why are you wearing a Red Robin shirt?" It's my work shirt. But anyway, here's my hair. You can see a little bit of thinning going on, kind of in this area. I think that's from the shock loss and the trauma of the surgery. It's completely normal, and not to mention that I just got back on Rogaine. I've been using it twice a day instead of once a day, and I got off. I was off it for a good 2 to 3 months, and I just got back on it. So I am noticing some shedding. Like when I play with my hair, I can see a few hairs falling out, and that is just the shock loss and getting back on the minoxidil. But anyway. Another thing I wanted to discuss is the Propecia and the side effects. This will be the last time I answer this question. I get asked this every time on every one of my videos. Is there any side effects for me? No, not at all. No erectile dysfunction for me, that's for sure. I know a lot of men are scared to get on it, but it's a less than 1% chance of you getting erectile dysfunction. So anyways, with my hair, it looks like some of the Bosley grafts are starting to come in. It's only been 2 months since I had my surgery with Dr. Scott Alexander. So, I'm not really expecting too much growth for a few more months. But it just looks like the Bosley grafts are coming in. So you guys can get a good glance at the top of my head. Anyway, I wanted to just go over a few things with selecting a good hair surgeon and stuff. A lot of people are uneducated about, selecting a good surgeon. There's only a handful of good, ethical, honest surgeons out there. And you need to do your homework, do your research. You need to find out what websites that they're recommended by, whether it's Hair Loss Network, Bald Truth, Specs Hair, any of those are good resources for you to do your homework and get educated and look at, some of the forum posts that they post, and just do a lot of homework before you make a decision into getting a surgery. I made a mistake by going to Bosley, just from what I saw on TV and not doing any homework. I just thought that they were the best because I saw them on TV. That turns out that they're not the case, and they're all about marketing and getting you into the chair and taking your money. That's why they have a freaking salesman, talking you into the hair transplant, instead of the surgeon. But anyway, another thing I wanted to go over is, what to do in your homework and everything. I personally wouldn't go to a place where they did more than one hair transplant a day. I think that's kind of, sketchy if you ask me. Like, if I'm paying all that money to go get a hair transplant, their main primary focus should be on me and no one else. And, if they're doing 2 or 3 other on there at a time, that's probably not the best place to go. I would only go where they're doing one hair transplant a day. And just a few other things you might want to consider is, what does the surgeon do to make, his or her results, spectacular? Do they use ACell, something to stimulate the hair growth? That seems to be, really put to a good use for hair transplants nowadays. How many hairs can they fit in? How many grafts can they fit in per square centimeter? To achieve a high density? Can they fit 50, 60, 70 per square centimeter? Like the surgeon I went to can fit 65 to 70 versus opposed to Bosley that can only fit 15 to 25. So that's just a huge difference in density. What techniques do they use? Do they use the lateral slit technique? That's also another big factor, because that's really the best way to go for getting that good look of density. It really gives you the best look for a nice dense hairline that you got. Another thing with being on Propecia, last thing I'm going to talk about here is I think the drug has worked very well for me. I haven't really lost any more hair than what the damage has already been done. You know, just my hair loss right here in the corners. Got a little bit of shock loss. It looks a little bit thinner right now because, you know, I put Rogaine in it this morning, and that's what Rogaine tends to do. You know, the minoxidil, it tends to make it look kind of greasy and thin. So I am experiencing shock loss, guys. It's just from the trauma of the surgery. You know, I got multiple hairs falling out. I can even see a couple falling out right now. You know, I'm just trying not to have that as a concern right now because, you know, from all the research I've done, it's completely normal. The only scary thing is if it's permanent or not. I hope it's not permanent, but I don't think it is. With the Propecia, you know, I still have all this hair that Mother Nature hasn't taken away from me yet. You know, I still got some nice thick hair right here, and, you know, Mother Nature already took this chunk out, these two chunks out, and I don't want to lose any more. So I think it's pretty much a must for me to be on a medication. Pretty much a must for me, guys, because at my young age, you know, I'm very vulnerable to losing more hair down the road. So, you know, this is my best bet. So yeah, if you guys have any questions, feel free to comment. I'm usually really good about answering any questions that you guys have. Please don't have it be about the Propecia. I answer that one too much. Anything else, you know, if I ever did have a erectile dysfunction with Propecia, I would let you guys know right away. I'd post a video, you know, right away. But I don't think that's going to happen. I'm just not really a big believer in the side effects that, you know, people out there claim to have. So yeah, I'm just not really a big believer. You know, it could be from anything, but they choose to blame it from the drugs. So anyways, I hope that you guys have enjoyed the video. I'm gonna get going now. I gotta get going to work soon, so I made this video quick, simple, and easy. Not really too much growth as expected. It's 2 months into my surgery. No hair concealer in it, no kabuki. This is my actual hair that I've going. I'll try and give you guys a closer look of what I got going. You know, you can see the shock loss right here, a little bit of shock loss I have going for me. And you can see, I'll move my hair around for you guys. Yeah, you guys can see my grafts and everything. Looks like these grafts are growing in better than these ones so far, but I don't think that's from a bit more hair restoration yet. I think it's still from the Boss League. So ultimately, we'll see how it turns out in the end. Alright, hope you guys enjoyed the video. Take care. Thank you very much.